So again, welcome everyone tonight joining us for the HCAM and PNHP fall update. We are so happy that you joined us, and just a few house rules beforehand. If you could put any technical issues in the chat directly to me, Judy Barton. I am the Director of Operations with Healthcare for All Minnesota. We will also use the chat for some questions, but there will be some Q&A time, and you will use the raise hand feature when we do that. With that, I'm going to hand it over to Ann Jones. Ann?
Good evening and welcome. And thank you, Judy and Jen Crawford, PNHP Executive Director, for hosting the meeting this evening. I am Ann Jones, retired registered nurse and Vice Chair of Healthcare for All Minnesota. Welcome to our fall update. Our presenters this evening will be Judy, Rose Roach, Board Chair of Healthcare for All Minnesota, Jen Crawford, again, Kip Sullivan, Healthcare for All Minnesota Legislative and Policy Committee, longtime activist in this work, Mark Brocky, Board Member of Healthcare for All Minnesota, and me. Our agenda is welcome from Rose, an update from Jen, a review of some of the work we're doing following the legislative session that ended in May to stay on top of legislation that got passed during this last session related to health policy and healthcare. A thank you to our volunteers from this past spring, summer, and fall, and a review of our restructuring and implementation that we've got going on with Healthcare for All Minnesota, a fundraising appeal, then some announcements, and a call to action, and then a wrap up. And I'm going to go ahead and then turn this over to Rose Roach, our Chair of the Board of Healthcare for All Minnesota and National Coordinator for the Labor Campaign for Single Payer.
Great. Thanks, Ann. I just want to note that there are a couple of things also on the agenda around. I'm going to make sure to talk a little bit about the restructuring of HCAM, as well as just give you all a little update on the forming of a statewide campaign to win the Minnesota Health Plan. So we'll also visit those two topics along the way. I too want to welcome everyone tonight to HCAM and PNHP's quarterly meeting. So much is happening right now within the healthcare landscape these days, so it's really good that we're all getting together tonight. We're dealing with the exposure of the health industry's greed on a massive level right now. From the American Prospect article about our very own United Health Group, that's just in our backyard, that stated, quote, "Today, United is the 5th largest public company in the U.S., bigger than JP Morgan Chase. Its insurance products serve 50 million members, more than the population of Spain, and its $186 billion health services division, Optum, has 103 million patients, more than Vietnam's entire population. Earnings came to $28.4 billion last year, putting it in the top 30 of companies worldwide." Then we have our friend Wendell Potter, who announced big insurance revenues and profits have increased by 300% and 287%, respectively, since 2012, due to explosive growth in the company's pharmacy benefit management businesses and the Medicare replacement plans that they call Medicare Advantage. The for-profits now control more than 80% of the national PBM market and more than 70% of the Medicare Advantage market. To a very scary stat article that informs us that, quote, "Behind the scenes, insurers are using unregulated predictive algorithms under the guise of scientific rigor to pinpoint the precise moment when they can plausibly cut off payment for an older patient's treatment. The denials that follow are setting off heated disputes between doctors and insurers, often delaying treatment of seriously ill patients who are neither aware of the algorithms nor able to question their calculations. Over the last decade, a new industry has formed around these plans to predict how many hours of therapy patients will need, which types of doctors they might see, and exactly when they will be able to leave a hospital or a nursing home. The predictions have become so integral to Medicare Advantage that insurers themselves have started acquiring the makers of the most widely used tools. Elevance, Cigna, and CVS Health, which owns insurance giant Aetna, have all purchased these capabilities in recent years. One of the biggest and most controversial companies behind these models, NaviHealth, is now owned by United Health Group. And don't think for 1 minute that this is only something that those of us 65 and over have to worry about. AI, or artificial intelligence, is the plan for all healthcare in the very near future. Just ask the nurses. And finally, we have the incredible report that was issued yesterday by the Physicians for a National Health Program with the help of our very own Kip Sullivan, entitled Our Payments, Their Profits, that found, by our estimates and based on 2022 spending, Medicare Advantage overcharges taxpayers by a minimum of 22% or $88 billion per year, and potentially by up to 35% or $140 billion. By comparison, Part B premiums in 2022 totaled approximately $131 billion, and overall federal spending on the Part D drug benefit costs were approximately $126 billion. Either of these or other crucial aspects of Medicare and Medicaid could be funded entirely by eliminating overcharges in the Medicare Advantage program. There's that private market that's being so much more fiscally efficient, right, than government ever could be. Not. We're all paying for this. Public healthcare dollars, just no public healthcare system. We have no public programs that are left in this country anymore. The deprivatization of those public programs is job number one for all of us. Whether it's the profiteers in Medicare, Medicaid, or Minnesota Care, they must go. So tonight is a really full agenda that includes meeting an incredible new HCAM board member, Becky Valencia from Paul, getting an update from PNHP, Minnesota's Executive Director, Jen Crawford. I'll spend a few minutes on what the restructuring of HCAM looks like, as well as the outline of a statewide, multiracial, multi-generational campaign to win the Minnesota Health Plan. Kip Sullivan will bring us up to speed on the work we're doing on the 2023 legislative wins. Dr. Mark Brockie is going to rally us around fundraising, and our amazing Vice Chair, Ann Jones, will bring it all home with upcoming events and a call to action. I'm so glad that all of you are here tonight. Lots to learn, lots to consider, and lots to do. So let's get started. Thanks.
Thank you, Rose. Would Becky like to say in a couple words? I see that you're here.
Yes. Hi, and thank you so much. And Rose, thank you, and everyone here for having me. Like Rose mentioned, I'm the new board member for Healthcare for All, and I'm super excited to be here, especially to learn from everyone. I know I've attended a few other sessions and have been absorbing so much information. And I think one of my biggest goals essentially is to be able to communicate all of the powerful information you guys are all sharing in these meetings over to other minority groups, including my Latino community. I first became involved with the healthcare system when I was like 9-10 years old, when my mother was diagnosed with cancer, and far well known how the healthcare system fails us all. And so I want to make sure to be able to bring back some information and be able to bring information from our community to the table as well. And so I'm excited, and thank you for having me.
Thank you, Becky. And next we'll hear from Jen Crawford, Executive Director of Physicians for a National Health Program, Minnesota chapter, and a board member of Healthcare for All Minnesota.
Hello, everyone. It is so great to see everybody here tonight. Thank you for taking a little bit of time to join us. I am just going to briefly mention a few things that have been happening over the past few months for PNHP Minnesota. It is a very busy time for us. If you see Rose Roach at all, she's usually a flash going from one meeting to another. And so it's been really hard to keep up a very busy summer. But some updates that I wanted to share with you today. The board of PNHP Minnesota has welcomed a new board chair. After 3 years of
an amazing effort. Fantastic leadership. I am not going to cry. That would be ridiculous. Dr. John Crossan, if you've had the privilege of being able to work with him at any point in time, you know that he is a fearless advocate for single payer. And he has been a phenomenal chair for PNHP Minnesota, for all of our members, for our subcommittees, going out and fundraising, being at the state fair. And it's been 3 years, and at this time, he is going to be taking a step back to help with some different committees, and we will be welcoming a new board chair. So I just want to take one moment to say, from the bottom of my heart, Dr. Crossan, thank you for everything you have done for our movement, for the people of Minnesota, and especially for PNHP Minnesota. You are amazing. And we're so glad that you're staying on to help us. And we welcome in our new board chair, Christy Atkinson. You may have met over the years. She is in her final year of residency. And so she will be joining us, taking the helm. She will be joining a bunch of subcommittees, and she will be joining us at our next update in December. So looking forward to hearing from her a little bit more about herself. But yes, we're very excited about the months to come with Christy. Another board member that we've welcomed at PNHP Minnesota is Rose Roach, a familiar face. She will be joining our board to make sure that HCA-MN and PNHP are aligned at all times because we do want to foster a strong partnership in our movement here in our state. And so we thank you, Rose, for joining us. One more meeting on your calendar, but we appreciate you. And we look forward to having you with us. New opportunities for our members. We have, along with HCA-MN, restructured a little bit, and we are moving all of our subcommittees. We are aligning and combining along with HCA-MN. And so we are excited to, as we work in this restructuring, we are welcoming people into this new start. And so we're going to be talking about that more today. So if you haven't heard about this, you don't know when your meetings start and where they're going to, we're going to talk about this more this evening. And a week from tonight, we will be talking more about each one of those opportunities. And so we hope you will join us a week from tonight as we talk about all of the many different subcommittees that you can become a part of. And we hope that everyone will consider joining us in really taking an active part in our committees. As Rose mentioned, we've had some big news over the past few days, and a big report was launched by PNHP National. And I just want to make sure that everybody knows that they are welcome to join us for an event that is coming up on October 16th. It is going to be discussing all of the findings of that groundbreaking report, and we're going to be activating everyone who cares about this movement. You, me, everybody. I hope that everyone will take some time to join us on that evening. It is October 16th. And if you have any questions, please feel free to put those in the chat. You can direct message me or Judy, and we're happy to get you all of those details. And lastly, before I let y'all go, I wanted to let everyone know that you are welcome to join us in Atlanta. In November, we are having our PNHP National Meeting. And I know that there are people who are on the meeting who will be joining us in Atlanta, and I look forward to learning alongside you and getting fired up to take on the new year, going into 2024, ready to take on Medicare disadvantage and all of the many challenges ahead and opportunities as well. So thank you everyone again for joining us tonight, and we look forward to seeing you again next Thursday to talk about subcommittee volunteer opportunities, and again on the 16th to talk about that groundbreaking study about the abuse by Medicare Advantage. Thank you so much.
Thank you, Jan. And back to Rose to talk about organizing our work.
Wow. All right. Let's see if I can pull up that. I'm going to share my screen. This always takes a nanosecond, so bear with me, folks. Hopefully this will work. I think everybody can see my screen. Yes. Okay. So
yet.
back in April of this year,
Rose, not
can
yet.
you not see the screen?
Not yet.
Oh, because it's coming up on both of mine. So I wonder why it's not sharing. Let me go back and see if I can hit the share button. Let me try it now and see if we can get it to go up.
It's there, Rose.
There we go. How's that?
Yep.
Now we're there. I'm sorry, everyone. All right. So as I was saying, back in April this year, Healthcare for All Minnesota, in collaboration with PNHP Minnesota, participated in a leadership retreat that involved board members as well as key activists and volunteers in an effort to really refocus our work, to strengthen our organization, and to begin thinking about the development of that statewide campaign to win the Minnesota Health Plan. One subtle change that we made was in our mission statement. You can see it there on the screen. We wanted to be really clear that although we are a state-level, state-based organization, and we are very much all about the Minnesota Health Plan and achieving that here in the state, we absolutely also actively support the national work that is going on to achieve Medicare for All. Those are not two things that are distinct from one another. So here is a, I don't know why that's there. Here is a flow chart. And this flow chart is giving you sort of a glimpse of what the new organizational structure is going to look like. So we're using what's known as the distributive leadership model. And that really just means that we want to not only spread out the work, we want to actually spread out the opportunities for leadership and for folks to be involved at the leadership level if they are so inclined to do so. So when you look at this chart, you can see, I'm going to look at it over on the side for a second. Of course, as in with any organization, number one is the members. You all are at the top of the flow chart. We have a board of directors. We have an executive committee, which consists of myself as chair, Ann as the vice chair, and Don as the treasurer, as well as our director of operations, which is Judy Barton. And then off of the board of directors, you can see that we have created 6 main committees. And the committees are listed here, I think, basically almost alphabetically, I guess it is. Audience inclusivity, and I'm going to explain a little bit about what each of the committees' role and responsibility will be in just a minute. But you can see audience inclusivity, education and training, communications, fundraising and development, legislative policy work, and organizing. And organizing has a little special, you can see, breakdown, and I'll address that in just a minute. But you can see a little bit also, it'll give you a little glimpse of the orange bubbles underneath the yellow ones. So when you're thinking about education training, the focus will be very specifically on online training, speakers bureau, material creation, communications, marketing, branding, all of the social media work that goes on, getting ready if we need to for any press releases or press conferences. Under legislative policy, we have also committees that are specifically sort of subcommittees working on the city council resolutions, and they are doing such amazing work there. And also around organizational resolutions as well, right? Getting various organizations to pass, Minnesota Health Plan and Medicare for All support resolutions. Organizing has really 2 subcommittees, one on coalition building, so that's bringing in organizations, and one on base building, that is more about bringing individuals in and being at all those wonderful events like we did over the summer at the State Fair and Pride Fest and Farm Fest. And then you can see that the Health Justice Allies goes underneath the coalition builders, whereas the base building is a little more focused on forums and event planning, as well as tabling at events as we learn more about them and want to schedule ourselves to be present at it. So I do want to mention that we're in the process, and by November 1 is our sort of target date this is already on the website, but by November 1, we're hoping to be able to make it interactive. So if you went on to the website and you said, I wonder what this organization's all about. Oh, there's a flow chart. I'm going to take a look at that. And then you were like, I like legislative policy stuff. You could literally just click the yellow bubble for legislative policy, and it'll take you to a document document that will tell you what the roles and responsibilities of that committee are. And then once the committees, they're all just beginning to start having their meetings, because we just put this into place in mid-September after we did the state fair. Those committees then will be developing a 1-year plan where they'll identify like maybe a couple of projects that they want to focus on and prioritize. And all of that will also be listed on that document. So you'll have a really clear understanding of sort of what you're getting into and whether or not it really is an area of interest for you and what you are hoping for. And I'm not going to take the time to read this because we always send this stuff out to you all afterwards where you can take a look at it. But here's a very general idea of the various committee work, legislative policy. You can see it's going to be all about tracking policy. It might even be about beginning to draft some legislation at some point. Who knows, right? Making recommendations on, sort of stepping stone legislation that we should be supporting in the meantime. Thinking about an annual lobbying plan. Those are the types of things that legislative policy will look at. Fundraising, pretty straightforward. We need to raise funds and to create what those events look like and make sure that we've got pitches ready for the various events. Audience inclusivity has already had a meeting, and this is very specifically part of their strategic plan that they put together for this year. So you can see here that it's all about ensuring that individuals feel very welcomed, valued, and represented by creating an environment that celebrates diversity, promotes equal opportunities, and addresses the specific needs and challenges that are faced by underrepresented communities, establish some inclusivity guidelines they'll be working on, creating equitable marketing and promotional opportunities, measuring means of accessibility, and collaborating with the community organizations to make sure, again, that we really are being as inclusive as we possibly can. Education and training will focus on everything we've got already because we built up a really good toolkit on education, but there's always opportunities for more. So we'll be looking at what are the new topics and trends we need more curriculum on. And then also, working on forums and managing requests for speakers and outside educational events and training others in the organization to be able to feel comfortable going out and training. And the organizing for the coalition builders, again, it's the conduit to the big statewide campaign we're hoping to put together with the health justice allies, and brings in those new organizations where base building will be doing the tabling, finding events for us to be out at, and having those one-on-one conversations with individuals who have an interest in this issue and how they can get engaged in our work. And then we'll have a comms committee that will oversee all of that work around social media, so in our internal newsletter, managing the press, for those press releases and press conferences and things of that nature. So again, this will all be available to you, but I will pose this question, you don't have to answer it right now. I just want you to be thinking about this. Which committee are you going to be joining? Which one sort of tickles your fancy and sounds like just the right fit for you, your talents and your skills and your interest level? So that's sort of in a nutshell, what HCA-MN is going to be looking like going forward with collaboration of PNHP specifically on these committees. And we're really excited about that. Thanks, Ann.
Thank you so much. Wow. Okay, I'm tired already. No. Hope you all will consider stepping up and joining this work, because it does not happen without you. Next up, Kip Sullivan, who is going to talk a little bit about our most recent legislative session and what we are following.
Let me see here. I've got just 4 slides I want to show you. And I want to get a marker. There was a very interesting legislative session, and I'm going to explain in 10 minutes why some of the reports that were authorized by the 2023 session of the legislature could really help us change the way healthcare has been debated in this state for the last half century. Let me begin by telling you something you already know, but maybe illustrating it in a manner you haven't seen before. I'm going to show you two charts, one showing how costly healthcare is in the US, and then another one showing you how costly healthcare is in Minnesota. This chart starts over here in 1980 and runs up to 2019. And you see the US at the top is an outlier now. We are a very expensive place to buy healthcare. We weren't always such an outlier. Back in the 80s, we were more like other countries. Something changed. What might that have been? It was basically the endorsement of HMOs and their cost control tactics by Congress and by some state legislatures, including ours, that backfired, added to the high cost of healthcare in America. So the US is an outlier as a nation. And now here we come to Minnesota. And it turns out that in 1991, we entered the 90s as an average cost state in an obscenely expensive country. So being an average cost in an obscenely expensive country, of course, is maybe not a whole lot to write home about, but at least you might have hoped that we wouldn't make it worse. We did. This is data from the Center for Medicare and Medicaid Services, the national keeper of expenditure data. They publish reports every 5 years on state level spending. And this is what they say happened in Minnesota. Beginning in the early 90s, we skyrocketed from being an average cost state to being 10 to 12% more expensive on a per capita basis. So you would think the legislature would long ago have asked the question, what in the heck went wrong? Hasn't happened. But this year, thanks to, let's see, what slide do I want? This year, thanks to 5 reports authorized by the legislature, we have a chance to begin a discussion about what went wrong and then how to make our healthcare system a whole lot better. The Minnesota healthcare system, Medicaid, and Minnesota Care. I'm going to describe each of these reports briefly. And we have a meeting coming up tomorrow with Governor Walz's. Rose, would you describe Yemen Schmitz as his primary health policy advisor?
I don't know if he's primary. I think the primary is the deputy chief, Leah Montgomery, but I think Iman is directly under her, specifically on health policy.
Okay, so we're getting a meeting with somebody whose jurisdiction is health policy in the governor's office, and he has in turn pulled in people from the Department of Human Services, DHS, and from Commerce. I'll tell you in a minute why that's important, but we meet tomorrow at 11 o'clock. Before I get into the description of these reports, and we're going to be discussing particularly this one, public option report, let me just do 2 definitions. Managed care is the label that began to appear in the mid-'80s, and it described the tools pioneered by HMOs. Those tools fall into 3 categories: financial incentives to doctors to get them to reduce services, micromanagement of doctors, and limited choice for patients. Administrative costs, I think they exist in every aspect of human activity. In healthcare, they are costs incurred by insurers and providers that do not finance patient care. And for insurance companies, they include marketing, creating networks, second-guessing doctors, processing claims, collecting premiums, lobbying, excessive management salaries, and profit. Now, these 5 studies that were authorized by the legislature in the last session are going to require us and the authors and eventually the legislature to talk about administrative costs, the role they have played in driving up Minnesota's costs, the role they play in making Medicaid unnecessarily expensive, our Medicaid program called medical assistance, and in making Minnesota Care unnecessarily expensive. I have put the public option report in red here because it's the first out of the chute. The legislation that calls for a report by February 1, Departments of Commerce and DHS did not specify what a public option is. This is all they said the report is supposed to be about. So you can see there's an enormous amount of discretion left to the Departments of Human Services and Commerce to issue this report. And by February 1, the Department of Commerce is supposed to recommend one. But DHS is supposed to write the report or contract with somebody to write it. And they're supposed to analyze several quote unquote models. Our goal is to get DHS to examine at least one deprivatized public option model. By deprivatized, we mean a version of a public insurance. We think this is based upon Minnesota Care, but even that much is not clear. It's implied. We want one version of a Minnesota Care program in which DHS sends payments directly to doctors and hospitals. DHS does not run money through insurance companies, so they can take 15% off the top before passing on the other 85% to doctors and hospitals. We see this as a very important issue because the public option report is coming out so soon. And so we're very happy to have this meeting tomorrow with E.M. and Schmidt. The public option report, like all of these other reports, is going to require that the Departments of Commerce and Health accurately assess the size of administrative costs in Minnesota, the size and the role that administrative costs are playing in driving up the cost of Minnesota Care and Medicaid. And I'll just, because the public option report is coming up first, I want to just use it as an example. When we make the argument that we can save money by deprivatizing Minnesota Care, currently Minnesota Care, as I think everybody knows, is privatized. Money goes through insurance companies. Insurance companies decide what to do with it, what doctors to contract with, etc. We want a deprivatized model. The main argument for deprivatizing the public option is that it will free up a lot of money that is now wasted primarily on insurance company overhead and secondarily on DHS overhead. Insurance companies, when they operate with a public program like Medicaid or Medicare, they spend 15% of their expenditures or revenues on those administrative costs that I just enumerated for you. Total waste of money, doesn't get to a patient, doesn't help doctors. Total waste of money, there was no reason to do it. The insurance industry will be, of course, recommending against a deprivatized public option model. And they will argue that you don't want to do that because we are good for patients. We make them healthier, and because we make them healthier, they cost less in the long run. So don't believe HCA-MN and Minnesota PNHP when they come in and tell you there's lots of money to be saved. So those are just in a nutshell, those are the two big issues that Commerce and DHS have to get right if they're going to produce an accurate and useful report by February 1, 2024. They've got to accurately report the size of the overhead costs that insurance companies bring into Medicaid and Minnesota Care. And by the way, they need to accurately report the impact that privatization had on DHS's overhead costs. We have some evidence, not really good evidence, but some evidence indicating that when state Medicaid agencies privatize, the agencies themselves see their overhead costs rise. And we think it goes from 5% of total DHS Medicaid expenditures to 10%. So you see the problem building for the HMO advocates. They bring 15% more administrative costs in, and DHS's overhead costs probably double. So now you've got 20% more administrative costs, all in exchange for what? I'm sure the average sixth grader in Minnesota could think of many better ways to spend that precious money than on insurance industry overhead. As you see here on these other reports, they also force the authors, and they give us the opportunity to talk about the role of skyrocketing administrative costs. Here's a report due in 2025, the Department of Health. They're supposed to recommend a set of actionable strategies to address administrative spending. Here's another report that's supposed to come out also from the Department of Health, periodic reports, not just one, examining unproductive administrative spending, and then something they call low-value care. I don't have time to get into that, but that's an issue we need to educate the Department of Health on. Here is a report that we are really looking forward to. It is due also in 2026, again from DHS, on deprivatizing Minnesota Care and our medical assistance program. And again, the same arguments will come up. HMOs will say, oh, you need us. And we're going to come in and say, no, they have not improved quality. In many cases, they harm patients, and they are wasting billions of dollars every year. By the way, sound familiar? It's exactly what we're saying about Medicare Advantage. This is maybe the most important study of all of them. It's a big, expensive study of the Minnesota Health Plan. And for those of you who are new, that's the name of our single payer bill that we've been working on for years. The legislature authorized, I think it's more than $2 million study. It's an awful lot of money for a study to be done by the Department of Health or the people they contract with. And it asks for numerous outcomes, everything from total cost of the state to what's the impact on prisons, what's the impact on absenteeism at work, et cetera. So this is a study that's going to require a lot of oversight from us. And I think I will stop there. I think that's the good summary of where we are. We have a legislative oversight committee. A number of us here tonight are on it. We've already gotten emails from people at the Department of Health saying, yes, we'd be glad to meet with you. Another email from people at DHS saying that in addition to this meeting tomorrow with EM and Schmitz, we would be glad to meet with you as well. So we don't know if that means they're going to agree with us, but they're giving us the time. They're giving us personal meetings and the opportunity to find out what they're thinking and for us to give them the evidence that we think supports our critique of the current system. But to go back to this last slide, just impress upon you what a mess Minnesota's is. Something went wrong here, and what was it? It was exploding administrative costs because in 1991 and 1993, two commissions recommended managed care cost containment tactics, as should be the state policy, and they spread like wildfire, both through public and private insurance programs, and it also set off mergers. And mergers cause the number of sellers in any industry to shrink, which gives them more power to raise prices. And in this case, they wanted to raise their prices. Why? Because their administrative costs were going up. So this is one of the charts that we're going to be showing to our good friends at the agencies.
Thank you so much, Kip. Next up is back to Rose to talk about our statewide campaign to win the Minnesota Health Plan.
Yeah, thank you, Anne, and thanks, Kip. Great recap of what we are working on and how everybody can be engaged in that work. So I'm just going to take a few minutes because this campaign is not completely fleshed out yet. Lots of work to do, but I wanted you to know we're thinking about it. And we really want you all to help us figure this out because this isn't anything just for a couple of us to do. This is really something for all of us to get together and engage in this campaign. So let me see here. There we go. I want to start actually by showing you a graphic that I think is really a terrific example that is created by the People's Action Healthcare Campaign organization or committee that is working on the campaign for Medicare for All. And so this is geared toward a national campaign, but the components are no different than what we would do on a statewide level. And it really starts with toxifying the evil industry that cares only about its profits and not about our health, bringing more and more individuals, unions, and community organizations, along with business owners into the movement. We need the right people in the legislature and in the governor's seats so that we have So we have to work, of course, to elect those candidates that go beyond just giving lip service to this issue and actually run, educate, and govern according to the principles of the Minnesota Health Plan. Then we strive to create new and unusual allies. We never know where the strange bedfellow may be here when it comes to an issue as personal as healthcare. So we reach out and we try to bring new and unusual alliances into the movement with us. And when we do all of this, then we will actually begin to change enough worldviews that has us believing, things like government's the problem, not the solution, and it can't ever possibly be so. The private free market can do healthcare so much better, and that we'll never be able to win this issue, right? Because the powers that be are just too powerful. None of that is true. We can win. And so we start to change that worldview, and then ultimately we will win the policy. So it's pretty straightforward, but however we're doing this campaign and whatever the issue is, right? The campaign really needs to start, of course, with some grounding around mission, vision, and values that are really centered on patients and providers, because that's who we should be worried about in a healthcare system. So I took a stab at just a couple of things that I think we can all agree on as far as grounding ourselves around what our mission, vision, and values are. This would be a work in progress that we would all have some time to actually have feedback on. But things like healthcare is a human necessity. Everybody needs it. We're all going to experience disease or injury or illness at some point. That's why no one, no exception, should be without access to healthcare. That the system has to put patients, families, and providers at the center in order to really guarantee true freedom and choice for affordable, quality, equitable healthcare, and stop sort of wasting money on anything but healthcare inside of the healthcare system. And 50 years plus of attempts to control costs, increase quality, and decrease disparities has done the exact opposite, particularly around racial health disparities. They've failed, and we must fundamentally change the system to achieve affordability, high quality, and true equity, and that the cost of healthcare has become untenable. It's a financial burden for patients, families, businesses, and even for government, but the ever-increasing price of healthcare will never, ever be contained, as we know, without a central payment system. So we have to get focused on that, and that we are, of course, committed to working for transitional reforms that would help build the infrastructure and create the conditions we need to achieve healthcare justice for all by implementing the Minnesota Health Plan. So that's sort of a basis from which we will kind of start to operate. And of course, as I said, build on that, edit. Nothing is in stone when it comes to a campaign, as you well know, other than winning. And then we kind of look at what are some of the goals, the immediate goals, because we really have, as based on what you just heard Kip talk about, we have some work we can be doing right now. Thanks in large part to the work that the current legislature did and the sort of stepping stone pieces that they passed in the last legislative session. So we can work on making sure we have input, making sure that those reports and studies and implementation plans go off in the right direction, as Kip laid out so well a few minutes ago. Work on that toxification of the industry, right? There is a lot going on around denials of claims and prior authorizations. That's both in Medicare, but it is also outside of Medicare. That is happening for anybody who also is in just whether it's the employer-based market or the private insurance market. People are experiencing those types of things more and more, which are barriers to getting care. Those are things that we have opportunities to expose, and I'll talk a little more about that in the next slide. We can recruit, educate, and help elect the candidates, as I said earlier, that are going to run on the Minnesota Health Plan, understand it, be able to talk about it, educate around it, have district meetings about it, and really engage their voters and their constituents in the campaign to win. And so we can, one campaign that we can look at doing, and I'll talk again in a moment about that, is all around getting candidates to pledge to not take money from the medical industrial complex, which can free them up to actually focus on how to fix healthcare. The campaign timeline, not 100% defined yet, but generally speaking, thinking about, trying to pass the MHP, the Minnesota Health Plan, sometime in the 27-28 legislative session. We do the work of building those stepping stones now based on some of the legislation passed, and there are some more ideas to come on that. We develop with all of you and with our partner organizations what 25-26 looks like, because we obviously have an election next year. So electorally, we will be engaged in getting the right sort of candidates into the House of Representatives here in Minnesota, and hopefully also for Medicare for All on a national level as well. And then we hopefully win in 2027, 2028. So these campaigns that are already existing that I was talking about, the one being the work we're doing on the current legislation that Kip just addressed, but there is a campaign by a organization called People's Action that I showed you the first slide on. People's Action and Take Action is a sort of an affiliate of People's Action. So we've got them right here in Minnesota as well. They're doing a care over cost campaign. They are finding patients who are battling with insurance companies that have denied them care that their physician providers have said they needed, and they are turning around and doing two things. They are helping that individual if they would like to appeal that denial, because as you all know, the appeal process is really cumbersome and burdensome, and very purposely so, because very few people ever appeal and challenge. But this organization has got attorneys and social workers pro bono helping people move through that appeal process, and they have won a number of cases to get those individuals the health care and the medication that they need, that the health insurance company was trying to say no to them about. At the same time, there's an organizing campaign that goes along with that. If the individual particularly is comfortable, they take and really push that and amplify their story publicly and do public like organizing events around the insurance company that denied the care. They're looking at us potentially here in Minnesota to do a big action against United Health Group. Probably not great timing. I get it. It's winter. Hopefully it will be okay, but sometime February, March, to give us some time to really build up and make it a pretty significant event that we could do. So there's two paths. One, to actually help the individual get the care they need, but also to make sure that we lay this at the feet of the insurance industry, who are causing so much suffering and pain for people. And then the nurses, National Nurses United, Minnesota Nurses Association is, of course, an affiliate of NNU. They have a Patients Before Profits campaign where they are going to candidates, whether it is school board, whether it is city council, whether it is Congress, state houses and senates, whatever it is, to ask them to please pledge not to take any money from the medical industrial complex. So we don't have to create new campaigns. We can plug into ongoing campaigns and really be part of this big sort of movement to toxify the industry, get the money out of politics, at least around healthcare for starters, at the same time that we're building those stepping stones to get to a place where the Minnesota Health Plan will be our future. So we all know, right, that what the components of a campaign are. We want to turn this into a really hot campaign so that everyone is just chomping at the bit to be a part of this. Basic components: education, organizing, outreach, fundraising, comms, legislative policy, and then electoral on an organizational level for the organizations that do electoral work. Individually, obviously that's just up to us if we individually feel comfortable doing electoral work. But this is exactly how we're going to build a structure for this specific campaign on these basic buckets. Don't have everything fleshed out yet, as I said, but that's what we're hoping to begin to bring folks together as the committees get up and running and the health justice allies get more grounded in this idea of a statewide campaign, bring people in and start really getting active in creating the campaign. So if we're going to get serious about that, then the question becomes why? Why would I want to be part of this campaign? What's so special about this? And particularly for our Health Justice Ally Coalition partners. And the way we presented it to them, and I think it's true even for any of us as individuals, the status quo is killing us. It is not sustainable for our lives, and it's not sustainable financially, as we know as well. So we want to make sure that this campaign is easy to plug into, that any campaign partners can build their organizational power through this statewide campaign, that the campaign will be sure to have a really concrete focus and define the concepts that we will be working off of, such as those building blocks for the pathway to winning. And we want to make sure that the campaign is about having a significant enough change for patients so that patients will see this is a good thing and this is the path we have to follow. We want to claw back those public dollars and take them back and use them for actual health care. And we really want to deconstruct what we're fighting for, so it's really clear what the win is, and how, folks are going to get engaged and become more and more interested in saying, wow, I love this. This feels good. What's next? What's the next thing we're going to do in order to win the Minnesota Health Plan? So are you intrigued? I hope so. Stay tuned, because you're going to have lots of chances to be both intrigued and to be fearless. So more to come on this as we get it developed, but we wanted to at least give you a little bit of a peek on what we're thinking about to date.
Thank you so much, Rose. I didn't officially build a question and answer period into the agenda, but I think we would have time for a few minutes of questions if anyone has questions they want to ask right now.
Dr. Crossan?
Well, I don't really have a question. I actually have a comment. Rose, you did a beautiful job of pulling together all the issues, and I just wanted to emphasize what you were saying. Obviously, there will be a lot of opposition to this. It will come largely from the health insurance companies who have a lot of money, but also the pharmaceutical companies and to some extent probably the healthcare conglomerates. But I just want to point out that people power is much more powerful than money power. Now, since there's going to be a lot of money, this means we have to get a lot of people. It's 40 people on this meeting is not going to do it. We have to get a huge number of people involved with this. And one of the issues with getting a huge number of people is that people are getting they're willing to accept what's going on, and they say there's no way we can make these changes. And this is the huge issue that we have. We've got to convince people that we can make changes. And maybe you'd like to comment just briefly how you meet with somebody who says, yeah, I really think this is something we have to do, but we're never going to get it done. There is absolutely no way we're gonna be able to overcome all these obstacles and get it done. How would you address a person like that?
Well, I would say we're already doing it. And that's why I think the beauty of the movement has to accept that we're not passing the Minnesota Health Plan in 2024. We're not passing Medicare for all in 2025. We have to do sort of a reality check as a movement and understand that we don't have the conditions right now to actually make either of those happen at this moment in time. That doesn't mean we can't start implementing change that will benefit patients and benefit providers and start moving the system, the profiteers and the private sector out so that people can actually, in an affordable way, start to access healthcare. All of the bills, whether they are on a state level or on a federal level, have sections about transitioning. So if we did pass Medicare for all tomorrow, the Senate bill says 5 years, the House says 2 years, whatever it is, they'd work that out obviously in conference committee. Whatever it is, it's not like we would get a Medicare for all card the next day. It's going to take time to implement it. What are we waiting for? Let's start implementing those pieces now. Biden has said he doesn't support Medicare for all, but Biden has also said he supports lowering the Medicare age from 65 to 60. He's willing to consider, some cost containment as far as caps and things. He's willing to consider expanding Medicare to include, dental and vision and things of that nature. This deprivatization work is so important. The fact that our legislature realizes that and is willing to start to tackle that now outside of passing the big encompassing bill, those are all wins for us. We are making those movements. They're not everybody immediately gets the relief. I get that. That frustrates all of us in this movement, but we have to realize we're not in a position to win it all in one big, huge bite right now. And so let's start taking piece by piece, build it up so that it's just a natural that we're all going to go into it X years, down the path, whether that is 4 years or 5 years, I don't know, but that's how we do it. And that's how I would respond to that. I don't know if that's helpful.
There is a question in the chat. Do we have a contact at People's Action with the Care Over Cost campaign? They have a couple time sensitive questions. I don't know if email Rose and
Gina, email me. I'll put my email address in here in the chat, and I can connect you up with the Minnesota contact for the campaign, who should be able to get you to their national and their folks that are working on helping people through that particular appeal process.
Great.
One more question, maybe, Linda?
Oh, thank you. I don't have a question. I have a comment. Words really matter. I think that how we convey a message really makes a difference in how people receive it. And I got a real pearl tonight. Calling Medicare Advantage a Medicare replacement program or Medicare replacement plan, that will get people's attention, because they'll recognize that this is something you do instead of Medicare, instead of Advantage, which would connote that it enhances Medicare. So thank you for that. I urge everybody to talk about the Medicare replacement plans. Thank you.
Yeah, thanks for that, Linda. And you're exactly right. Anybody on here who doesn't know, Medicare Advantage is not Medicare and it's not an Advantage. So don't get it mixed up. It's privatized health insurance plans that are just being paid from, Medicare funds, and the amount of money that they're stealing from us is bad. And we got to do something about stopping it. And Ann's going to have some ideas for you on that here in a few minutes. So thanks for that, Linda. Appreciate that.
Okay. I want to take a few minutes to say thank you to all the amazing volunteers and acknowledge all the great work that's been done so far this year, especially during this spring, summer, and fall. We have been extremely busy. A lot of people who volunteered are on this call this evening, but remarkably, for a fairly, I say we punch above our weight, honestly, for a rather small but scrappy group with Healthcare for All Minnesota and Physicians for a National Health Program Minnesota. We've had either been at events, had speakers, had organizing events, or otherwise had a presence, supported events going on in Red Lake Falls, up near almost to the Canadian border, down to Redwood Falls. We've been to Duluth. Activists in Duluth have conducted events and done amazing work over the spring, summer, and fall. Mankato, Woodbury, Maple Grove, the Twin Cities, Stillwater, Northfield. We've been at the state capitol. We were up in Pierce, Minnesota for an event. Let's say, did I say Red Lake Falls? State Fair, at the Pride Festival. I'll to I guess add to what Rose has been talking about. Our job as an issues an advocacy organization is to bring people to the fight and create more of us, and then create the demand. I mean, so to whether or not this can happen, I understand that many of us, most people are so used to this broken system that they almost have a hard time imagining that it can be different. So we do have to be the people who can share the hope and also the facts about what's broken and what can be done to fix it, and what our plan is to fix it. So we, to that end, spend a lot of time educating and engaging the public. We spent doing a lot of work to build our base of support. And some of the other events on this slide, building skills of volunteers to act and influence change. That's the education and training part as well. Train and provide speakers, organize actions to promote change, link effectively with other organizations, interact with our elected representatives on health policy, hold candidates accountable, and ultimately create the political will needed to pass and implement legislation. So all of our work is around those three big areas: educate, organize, legislate. So again, oh, how did I get a recorded? We started in January. The medical students at the university held a rally to oppose that very costly, ill-considered merger. And then we moved on to things like Ken speaking in Stillwater. And we were at the Capitol. We held a screening of an event of a movie about the how hospitals are failing us. We were at the Pride Festival. A lot of people volunteered. We have that takes a lot of people to talk to the crowds of people who come to the Twin Cities Pride Festival. And there were also Pride events in Mankato and Duluth that volunteers in both of those areas staff. And we had a lot of, again, participation from medical students and other hardy volunteers. Weather was really a challenge this year. We celebrated the 58th birthday of Medicare. This was Farm Fest. We were down in Redwood Falls, up in Pierce. And I wish I were more clever at assembling these photographs, but you get the idea. Then we had a lot of volunteers, 12 days, 12 hours a day at the Great Minnesota Get Together. It took a lot of people, and we talked to hundreds of people. This is an amazing way to do some base building. So again, many thanks to, I'm sure I'm missing some events and didn't get a chance to highlight everybody, but just from the bottom of my heart, thank you to everyone who has volunteered. We have events coming up yet this year, and there will be opportunities to join in this work and build our base of support to win the Minnesota Health Plan and eventually Medicare for all. So I will turn it over to Mark now to talk about funding our work. Mark?
Yep, I am here.
Okay.
And I am delighted to be able to chat with the group this evening. As we all know, U.S. healthcare is an expensive and inequitable mess. We spend twice as much for healthcare as the average of the other modern high-income countries, and in return for that, we have millions suffering from medical debt and medical bankruptcy, and our public health outcomes are the worst in the modern world. It is truly unacceptable. Fortunately, our current Minnesota government has a problem-solving perspective, and during the 2023 legislative session passed several bills which you've heard about, which are focused on healthcare finance reform. But much remains to be done. Rose has done a great job of outlining what we have in mind for the next few years. We are currently at a stage similar to having a blueprint for a house, but the house still needs to get built. There are many ways the current progress might be derailed, and we must redouble our efforts to keep this reform on track. Common knowledge is our automobiles do not run without gasoline or motivated electrons. Sailboats do not go without wind, and nonprofits do not survive without funding. All our board members are giving financial support to Healthcare for All, in addition to the talent they give and the hours they spend working on our critical mission. But that is not sufficient to support our work. We need your help. We need your help, and we need the help of your friends and your contacts. As you know, it is essential to reach both Minnesota voters and our legislators. The Minnesota legislators have huge demands on their time. Many organizations are continually lobbying for their particular cause, and Healthcare for All Minnesota needs to get the legislators' attention and make a persuasive case for single-payer health care. We need to be able to communicate with many Minnesota voters, so those voters will in turn motivate their elected legislators to make the correct decisions. Effective communication requires our having an effective director of operations and an adequate social media outreach. We also have to cover the cost of participating in the events that Ann was describing and the events that we're going to be planning to do in the future. These include the State Fair booth, Pride festivals, Farm Fest, printing educational flyers, paying for our webpage, paying for our Zoom account, paying for the cost of supporting our database provider. These are all substantial expenses. Please consider supporting Healthcare for All Minnesota financially. Automatic monthly donations are very helpful in managing our finances. If you are already giving regularly, please consider recruiting a friend to support us. Our ability to succeed depends on you. Please generously support our critical work. With your help, we will be able to work effectively to achieve our common goal. So I want to thank you all for attending this evening, and thank you for all the support you have given for Healthcare for All Minnesota in the past, and the help that you are going to give us in the future as we progress towards this exceptionally important goal. Thank you.
Thanks, Mark. Okay. What can you do to learn more and continue to participate and support this work, in addition to contributing financially? We have some events coming up. In our next event is the one Jen talked about. The next event that Healthcare for All Minnesota group at St. Joan of Arc Parish is Sunday, October 8th. Medical student Allison Leopold will be presenting with a program they're calling Patients Over Profit Single Payer 101. That is noon to 1 o'clock at the St. Joan of Arc Parish Center on Sunday, October 8th. And then Thursday, October 12th, we have a virtual activities fair. That's where we're going to talk about maybe how, well, first of all, we want to welcome new people who we just maybe met this summer, spring, summer, and fall with some of our outreach activities. And then also welcome returning advocates. This is the first educational event we will have had in a while because we've been so busy with outreach. And then we want to talk about ways to get involved with some of the work that you heard as part of our restructuring plan and then our campaign to win the Minnesota Health Fund. So that's an opportunity to join again and hear more about, think about what might interest you as far as participating personally. So that's 6:30 on Thursday, October 12th. Thursday, October 19th, a week from then, is what Indivisible calls their third Thursday event. This will be virtual at 7 p.m. And Rose is going to be speaking along with Senator Liz Bolden, who is a champion for the Minnesota Health Plan in the legislature with us. And the topic they're calling this How to Improve Minnesota's Broken Healthcare System. So consider joining. When you get the slides, these links should be active for you. If not, the events will also be on our organizational calendar, and you can always register for an event using our calendar.
I'm putting it in the chat, Anne.
Oh, perfect. Thank you. Thanks, Judy. And then please let us know of local events that we should promote to help with turnout for them, and or opportunities that you know of for us to be present, to table, give out information, organize, and continue our base building work. And then also, again, reminders to continue to respond to action alerts, which I am going to move into going in a minute. And then always keep checking our calendar, healthcareforallminnesota.org, PNHP-Minnesota.org for upcoming events. So one big thing that we just learned about a couple days ago, one of our supporters kind of behind the scenes, Chuck Smith-Dewey, sent this on Facebook. I believe he's still one of our sponsors of our website. Also, I just want to acknowledge Chuck Smith-Dewey. There's something called the Twin Cities Film Festival. You all may know more about this than I do, but there are a whole bunch of films in that festival. There is a series, however, called the Changemaker series, and the theme is healthcare disparities. And Judy's going to put the link for that in the chat, I believe, for dates and tickets. It's a combination of theater and streaming. I believe you can buy a ticket for the whole series. And a couple things I'll highlight. This one, The Power to Heal, is excellent. We had a showing of this 3 or 4 years ago. Inhospitable is a new documentary about problems with for-profit hospitals. And I don't know if anybody knows anything about the others, but I'm looking forward to viewing these. So that's coming up in October, end of October. And then I want to mention a way that you can help that costs you nothing but a few minutes. And we need your help to spread our message via social media sites, especially our Facebook and Instagram sites. We really, really, really need more engagement within both of those. Twitter is kind of shall we say, odd right now. So there's probably not a lot of traffic on Twitter, which is X. But Facebook, we really, really need you to go in, look for new posts, react, share, engage. And then Instagram as well. Jen Crawford is doing a great job of posting on Facebook and Instagram. And then please check out our YouTube channel, Healthcare for All Minnesota. Subscribe, like, share. There's a ton of stuff on there. All of the stuff that we've done in the last probably 4 years is recorded. All of the programs we've done and all of the meetings we've held are available for you to go back and view. So that's my pitch there. These are websites of really, really good information, good stuff that you might want to check out. Part of this game is learning how to talk about this issue. And you can get lots of information by viewing the Fix It series films, by reading Senator Marty's book, which is on mnhealthplan.org if you don't have a physical copy, by using the PNHP.org website. That is an unbelievable wealth of information, especially the economics of single payer financing for healthcare, our website, and then PNHP Minnesota's website. And then here are some really great organizations who've been in this fight for a long time. One Payer States, Healthcare Now, based out in Boston, the Labor Campaign for Single Payer. Rose is the new national coordinator for the Labor Campaign for Single Payer. I think I can quote Rose and say, this will not happen without the support of labor. So we really, really, really want to partner with organized labor in this country to win this change that we want. Public Citizen has been in the fight for a long time. You can, Social Security Works, if you've never heard about them, they're an incredible advocate for Social Security and Medicare. And Healthcare Uncovered is shocking information at least once a week by Wendell Potter about the absolute greed and obscene amount of money flowing to the for-profit side of healthcare, especially the insurance industry and the pharmaceutical industry. And then Health Justice Monitor is just a whole lot of good information and policy. So there's a lot of ways to stay informed. There's really kind of a fire hose of information available now. If you choose to tap in, it's almost more than you can keep up with, but it's good information and will give you the background. It will also help, I think, create the sense that the status quo is not acceptable and we need to stop accepting it and move for change. So that's my pitch there. Next up is a call to action. Something you can do right now. And by now, you know that we're very concerned about preserving Medicare as a publicly funded and publicly administered healthcare program for seniors and the disabled. So what can you do about the fact that we are in a very upsetting era of privatizing and monetizing Medicare? First, learn more about what's happening. Understand that original Medicare administrative costs are 2%. Medicare Advantage is not Medicare, it's commercial insurance, and overhead and profits are costing us 15 to 18%. And there's a next step that's even worse than that called ACO REACH. Advantage plans are draining the Medicare Trust Fund. And please go to the PNHP website and read this brand new report that details how this is happening, and the fact that Congress has known about this for some time, and we need to push them hard to act. So we'd like you to call the White House. And the number for the comment line is right here. Call your United States senators and call your particular member of Congress and give your name, zip code, name, phone number, zip code, state that you are a constituent, and you can feel free to use this script. We are trying to tell the president, our members of Congress that, and I don't have the number for the Health and Human Services Secretary because I just ran out of time to find it. But we want to let them know that a new report from Physicians for a National Health Program called Our Payments, Their Profits documents truly egregious overpayments to Medicare Advantage companies, estimated to be between $88 and $140 billion a year. That is enough money to improve traditional Medicare, add vision, hearing, dental, put a cap on out-of-pocket expenses, improved our ability to pay for drugs, and probably get to 100% coverage. We could vastly improve Medicare right now if we stopped wasting this kind of money. So tell them it's time for Congress, the White House, Health and Human Services, and CMS to act. These insurance companies are bankrupting Medicare through outright fraud and abuse, and it needs to be stopped. So, and I wrote this to say, I'm asking you to protect, improve, expand traditional Medicare, hold the commercial insurance industry accountable for their immoral profit-focused tactics, and please make it your priority, Senator Klobuchar, Senator Smith, Representative Omar, to protect and preserve Medicare to assure health security for seniors and the disabled as originally intended. There's a program coming up being put on by Physicians for a National Health Program on October 16th. And it's called Open Season. Corporate health insurers are targeting our seniors. You can register for that on this site. And then I will end by saying happy fall, y'all. And turn it over to Jen and Judy for any wrap up.
Thanks, Anne. Sorry about that. I'm just trying to put in a few more things in the chat for everyone. You can feel free to save the chat if you want to save some of those links. There is the ability to do that, I believe. I'm just there's like 3 dots at the bottom and it says save chat there if you want to do that underneath the chat. We will also send out an email by early next week with all of these links in it as well, so you will get them that way, as well as a recording of this webinar. Jen, do you have anything you would like to add from PNHP?
Nope. Forward to seeing you all next week and again on the 16th to discuss more about Medicare Disadvantage.
Sounds good. Again, thank you everyone for joining us. Hope you have a wonderful evening.
Great meeting. Thank you.
Thank you.